Welcome to our Haibo Coronavirus video series, a series with informative and factual news. The COVID-19 basics. Knowledge is power. To best fight this virus, you must know what you are dealing with. What is COVID-19?
Covid-19 is an infectious disease caused by the newly discovered coronavirus that attacks your lungs.
How does the coronavirus spread?
It is mainly spread by people who are infected with the virus. These people may produce saliva and nasal discharge as well as cough or sneeze droplets that may contaminate surfaces and objects or land on people close to them.
How do I catch the virus?
You can catch the virus in one of two ways. By touching any surfaces of objects that have been contaminated by people who are already infected with it and then touching your eyes, nose or mouth, or by being touched, coughed on, or sneezed on by people who are already infected. The cough or sneeze droplets can reach you within a 1 meter distance. Simply put, the new coronavirus spreads in a very similar way to a normal flu.
What are the symptoms?
To date, reported symptoms range from mild to severe breathing illnesses that mostly include any or all of the following: fever, cough, tiredness, shortness of breath, muscle pain, sore joints, headache, chills, sore throat. In fewer instances, patients have also experienced nausea, vomiting, or issues with their sense of taste or smell.
Who are most at risk?
To date, most people who have tested positive have only experienced mild symptoms and have recovered fully. However, for some, the symptoms are more serious, may require hospital care, or may even be deadly. In general, the people who are more vulnerable to the virus are older than 40, have weakened immune systems, have pre-existing conditions such as diabetes and heart and lung diseases.
How can I minimize the risk of getting infected?
Practice social distancing, don't arrange visits and work from home if you can, stay at least 1.5 meters away from others when you go out in public, wear a cloth mask when you go out in public, follow the sanitizing procedures of any shops and facilities you enter, wash your hands often with soap and water or use 70% alcohol-based sanitizer, avoid touching your eyes, nose and mouth with unwashed hands, cover your cough or sneeze with your elbow or tissue, then throw the tissue in a closed bin. Stay clear from sick people, stay at home if you feel ill at all and keep a distance from other household members, frequently clean and disinfect all touchable objects and surfaces.
What must I do when I display some symptoms?
Self-isolate for at least 14 days, stay at least a meter away from other members of your household, contact our public healthcare authorities and follow their prescribed procedures.
Resources. Here are some helpful resources to stay up to date with the latest coronavirus news. Thank you for taking the time to watch our video. This video series is brought to you by Business Writers and SAUEO.